I was also a transitioning faculty grantee. Thank you very much. And I worked on, I took a couple of mental health screening instruments that I'm particularly fond of, and they were already translated into Spanish, so I worked on them to make sure they were locally appropriate, and then tested them on several different groups here in the El Paso area and in Juarez. We were not supposed to go to Juarez, but I hired people to do those interviews for me. So I just wanted to talk a little bit about the instrument. I should preface this, I'm actually a medical anthropologist. I'm not a statistician or anything like that. So I lean toward the qualitative. So we were looking at these instruments. The reason I like them is because they're thorough. Two of them are very brief. They measure trauma. And I know in this area, if you can see from this excellent poster in the corner, we're very interested in dealing with the trauma and the after effects of the violence that's currently going on in this area, particularly with Juarez. The instruments that we had have been translated into a number of different languages, and we chose the Spanish from Mexico City. And that would have been, it was kind of the closest, because there were Peruvian versions and Puerto Rican versions, and we figured that the Mexico City version would be closest. And our target group are low-income Latinos, Hispanics. I use Latino because that lets me include Brazil, where I worked for quite a while. The Harvard Trauma Questionnaire was, well, the first. There's two that are paired, the Harvard Trauma Questionnaire and the Hopkins Symptoms Checklist. So the Harvard Trauma Questionnaire was developed at Harvard to address the increasing number of genocidal situations, conflict situations, things that like we have going down here that, you know, I think we're too close to really see it as a serious conflict situation, but it is. Natural disasters like Katrina and Banda Aceh, assessing trauma from things like that. So they're thought to be the global health challenge of the 21st century. The people who developed it, Richard Mollica at Harvard and several of his partners. So it was originally developed to address the trauma in Cambodia from Pol Pot. One of the people who worked on it, Svang Tor, she's a survivor of the Pol Pot regime. So a lot of the traumatic events that are probed come specifically from situations like that, and I can really see her fingerprint on it, because they ask about things like brainwashing, and those kinds of things happened in the Cambodian problem with Cambodia and Laos and Vietnamese victims. These are designed to ask about painful experiences that need to be assessed. You need to gain trust. People need to open up. So they have to be fairly brief and matter of fact. And the thing I like about the Harvard Trauma Questionnaire is that it includes in the middle section, it asks for two narratives. It asks the participant to tell the interviewer about the worst thing that ever happened to them in their life, and then the worst thing that ever happened to them recently. And in my testing of it, I said recently is since 2008. And those two narratives can be the same. The scoring is very, very simple. There are like 4 choices: not at all, a little, quite a bit, and extremely. And those are scored 1, 2, 3, 4 in points, and then divided by the total number of questions. And these questionnaires are divided into specific, you can divide them so that you score only depression or score only anxiety, or you can get an overall score. These are some of the things that, I don't know where I started. Some of the things that the Harvard Trauma Questionnaire asks about: lack of shelter, lack of food or water. Some of them will be germane to Juarez and some will not. When we were testing, we asked our respondents if the questionnaire made them think of events in Juarez, and they all said yes. Ill health without access to medical care, destruction of personal property, combat situation, terror situation, sexual abuse, torture. Then there's a series, extortion or robbery. And there's a series on, kidnapping, We hear a lot about that. People being forced to do things that harm others, people being forced to betray their colleagues. And I haven't heard that much about Juarez, but I know that this happens in other conflict situations, like the Shining Path and other situations like that, that people are actually forced to cause harm to other people. So here's more of the seeing the murder or death of the spouse or child. Then there's a series of disappearances. We hear a lot about that. Disappearance or kidnapping of close family members or serious physical injury. And then there's a series on witnessing. So witnessing can cause as much trauma as actually being a victim of the violence. And then they have an open-ended question. There's two open-ended questions: a situation that was not mentioned and a situation that's so painful they can't talk about it, and we don't ask them to say what it is, but they just say that, yes, there was another situation. So the section 2 is what I was telling you about, the qualitative section where it elicits a narrative. Section 3 asks about beatings to the head and strangulation, loss of consciousness, and starvation, which is very interesting. And we tested, I had a sociologist from Juarez test it on 2 groups of victims of domestic violence. One group was in a shelter and the other group, I think, was in an opera. And a number of them had been starved. And one person lost 60 pounds. And it was quite horrifying. So that, yes, all these things all happen to people, so it's disturbing. And Section 4 asks about classic trauma situations like the PTSD symptoms, recurrent or intrusive thoughts, nightmares, feeling out of your body, avoiding people or places or memories so as not to cause the memory to come back, numbing, startled response, and so on and so forth. So I do really like this instrument. The Hopkins Symptoms Checklist has 25 points, and it looks at anxiety, basically anxiety and depression. And it's, again, very simple scoring. And it's meant to be used in conjunction with the Harvard Trauma Questionnaire because it picks up current symptoms that the person is having right now. They're intended for screening, research, and clinical assessment. They're also intended for non-clinicians to use. Maybe that's why I like them. And they're brief, they're adaptable. Then according to Richard Mollica, they may have better psychometric properties than long, complex clinical interviews. That is a quote. I can't respond to that. Maybe the psychometricians could explain why that might be. So we revised this version and we tested on these groups. We're currently testing it on college-age adults. I have a UACJ student who's interviewing his age group colleagues. So I only have 4 minutes left. So then we did the Composite International Diagnostic Interview, or the CD, developed by the World Health Organization to address cross-cultural issues, because some of the psychological instruments are they're developed in the West, and so they're basically, aimed toward Western thinking. So this was developed to fill in the gaps if you need to take this instrument somewhere else that's non-Western cultures. And again, it can be used by non-clinicians. Changes, let's see, the PTSD section is really thorough and it was expanded in 1998. This instrument assesses 12-month lifetime and the worst PTSD episode. It assesses the sources, and then, these are just the revisions. So there's a screening, and that's coded. If someone doesn't report symptoms, then the interview's over. But it's coded so that the interviewer knows exactly which section to go to next, whether that's depression or PTSD, anxiety disorder, so on and so forth. You have to go get trained at the University of Michigan and then buy a license to use the scoring algorithm. And so we revised the screening, the PTSD, the depression, and the anxiety sections to be locally appropriate in Spanish, and we tested them on student volunteers. Then this is just a list of the trauma events that the CD asks about. and it's in Spanish. I don't think I have time to read it. Then there's a second section, personal violence. I'll go back if I run out. And then a third section, events that happen to others. And this one is a little different because it asks people if you hurt someone, if you killed someone. So that's good for people who have been soldiers. So we did use the following steps. We tested the original version with focus groups, and we had the focus groups tell them they'd say it that way, they wouldn't say it that way, and then we made revisions based on what our focus group said, and they were all at the same socioeconomic level as our target group. We made the revisions, then we retested the revised instruments with focus groups again, and back translated to make sure that it meant the same thing as the English. And now we're testing them on participant cohorts. And now we're currently analyzing the data. I have raw scores, but I need to do an item by item number and get the algorithm for the CD. Now I'm stuttering because I'm rushing. So what I'm planning to do in the future is I'm going to work on these two instruments for pediatric use, because I think they're too hard. I wouldn't want to ask these questions of children because they're very harsh. So that's what I'm planning to do next. And we've submitted an R21 in which we plan to use all three instruments to get a baseline mental health profile of our participants. So I guess I'm done. That's it. Thank you. Questions?
How many people participate in your focus groups?
5 at a time. And then there was always one bilingual, bicultural person, and me. But then the rest that didn't have to speak English at all. So.
How many focus groups?
4.
All right.
Yeah. Why? Can I have a question for you? Why would that be more psychometrically? What did he say? Why would it be easier to test this psychometrically than a complex? Just because of the brevity of it?
Can you go back to the slide?
Maybe because it's more standardized. Clinicians doing it, they might just be not good assessors.
I can't find it. Oh, here. Better psychometric properties in non-complex clinical interviews. So you were saying, I'm sorry? Because?
I was saying it could be if the clinician it doesn't do it in a standardized fashion, or if there's a lot of inter-rater variability across clinicians, that can compromise the psychometrics of a longer person oriented interview.
I see. Okay, thanks. Any other questions? Yes?
I probably missed this from the presentation, but how was the sample gathered?
Convenience.
Convenience sample? Okay. Can you
Yeah.
describe that a little bit?
I assembled these focus groups of people that I know from a socioeconomic level, basically people who commute up here to work in the informal economy, and that are Spanish speakers. Didn't have to be bilingual, basically. And then the sociologist went to the shelter and asked who was interested and got a good response. And then also she works with a school, I think, in opera, and worked with parents. So it was neat to get data from Juarez, but on the other hand, you let go of control of the study a little bit. So that I wasn't very comfortable with that, but the data is very interesting. So the narratives and things. So yes.
It will be interesting once you do collect the information to see the effects of violence. Is there existing literature that uses these same instruments specifically on a Latino community that was suffering trauma due to drug violence?
They were used in Peru in the time of the Shining Path, Sendero Luminoso. That I know. I don't think. I think that's the only thing I can think of off the top of my head. They've been used pretty extensively in South Asia, Southeast Asia. So. Any other, oh, 0, I'm out of time. Thank you.